Hello, and welcome to Psyched for Sanity. I am one of your hosts, Dr. Brindle Doss. I'm a licensed psychologist specializing in forensic psychology, geriatric psychology, trauma treatment, and assessment.
I'm Dr. Tara McKelvey Parker. I'm also a licensed clinical psychologist. I specialize in assessing and treating complex trauma and attachment wounds from childhood. And I am a recovering perfectionist.
Oh, okay. There was a pause there. I'm like, I know a lot about you, but maybe I'm about to learn something new. Recovering perfectionist. Okay.
Yeah, we decided to do an episode on perfectionism.
Yes.
And so it had me thinking a lot about my history, my, background. When I was in school, particularly like middle, high school, I was very stereotypically perfectionistic. So like straight A's, like spent hours upon hours working on my assignments. I would like literally go to the library all weekend and just like do homework.
Wow. Okay.
And like all the organizations, I did all the things. I remember like in my yearbook one year, I think this was like 7th or 8th grade, everyone wrote, "You are so smart." Like literally everyone wrote, "You are so smart."
Whoa.
You are so smart.
Putting more fuel on the fire.
Or "You are so pretty." It was like, I
Those
tried,
are both nice things.
tried very hard too with my appearance. It was very like classically perfectionistic. But when I got out of high school, I went to college, I chilled out a little bit and I'm like, I'm not perfectionistic. And then I realized really over the past couple years and especially writing it all down on paper, that I am still very much a perfectionist, even though I do think I've made a lot of progress on it over the years. But I can definitely identify with a lot of the material that we're going to cover on this episode.
Well, and I think when you mentioned it, I was kind of like, perfectionism, that's, not that it's not a thing. I guess I don't identify as a perfectionist. You're laughing. I think there are elements that I can be really hard on myself about.
Maybe certain areas.
Yeah, for sure. But a lot of the things for me don't connect on a personal level, and I think it's been helpful. You had some self-awareness when you were doing your podcast prep. When we were prepping for this episode on my end, I was like, oh, I need to learn more about this to be more helpful to my patients that may struggle with this. And so this research was super informative for that process too.
Yeah. So perfectionism.
Right.
What is it?
What is perfectionism?
It's not just high standards, although perfectionists do have high standards.
Yes, they do.
But really at its core is a person feels like they must gain worth or safety or belonging by doing well enough or meeting these high standards.
Yes.
So it's not just high standards. It's like, my sense of safety and what I am worth and if I belong really depends on doing well at these certain things.
Performance equals value.
Yeah, it can be. One of the thing, performance equals value. I'm worth something when I perform at this particular level. And that certainly was what drove, I think, all of my perfectionism around achievement in school. And, I got a PhD and there's certainly some perfectionistic strivings, I think, underneath my achievement.
Right.
Yeah.
Didn't you also run a marathon while you were getting a PhD?
Yeah, I did a marathon. Yes, I did a marathon. I did a musical. I did all kinds of things. I just like to do things. And so there's some perfectionism, I think, under there.
Under there?
Is that what you're saying?
I'm saying it's like right there. It's not under it. It seems like it's like more front and center.
Anyway, so a lot of times then, at the core, there's usually quite a bit of insecurity and fear.
This was fascinating to learn about.
Yes, that's driving the perfectionistic behaviors.
Okay.
So,
so fear in this realm is like, this is perfectionism would protect against the fear. Is that what you're saying?
Yeah, there's, yes. So it's like something bad is going to happen to me if I do not perform this task at this uber high level.
Right.
So like if I do not get a straight A or if I do not do X, Y, and Z, someone is going to make fun of me, right? Someone is not going to like me. There's all these fears. And if you trace it down even deeper, underneath that is, I am not good enough.
Right.
Like, I'm not acceptable the way that I am. I must earn these grades or look this particular way or do these particular things in this really high, sort of like rigid way
Yeah.
so that I can feel safe, so I can feel good enough, so I can belong.
Right.
And so that's really hard because then the goalposts constantly moves.
Yes.
And when you're a perfectionist, nothing is ever good enough and nothing is ever finished.
Yes, it's so exhausting.
It's exhausting. It can be absolutely exhausting. So I think, while I'm not in school anymore, striving for straight A's, I still very much recognize that when I don't feel good about the way I, like a session with a patient, I might tend to beat myself up, right? Or like really there's that insecurity that pops up or that fear about, they're not going to want to keep coming. And then my, stress around money and other kinds of things about being a good enough therapist start coming up. So, and that way, I think I still very much identify with the perfectionism.
Yeah. The part I could connect with is there have been moments in my life that I have not felt good enough. I think that, so there might be just unconnected pieces in myself that I experience. I'm also, we've talked about my values in the past, and I place a lot of value on achievement. So I definitely think to a degree, I think it can become problematic where you have real struggles with perfectionism, but I think all of us might have elements.
Well, and you're bringing up a good point because I do think that there is a difference between excellence and perfectionism.
Okay.
So, I do think I also really value achievement.
Yes.
And I want to be good at what I do.
Sure.
Like, it matters to me to do a good job.
Yeah.
And so there's nothing wrong with having high standards for yourself. And so this is not a video about just lower your standards.
No. Or just accept what you don't find comfortable necessarily.
Right. So it's not about that. I mean, excellent. But when someone who's just striving for excellence, normally, they know when to be done.
Okay.
They have high standards, but they're not like endlessly revising and they're not beating themselves up for mistakes. Typically, people who are growth oriented, strive for excellence, they're growth oriented. They learn from mistakes. Yeah. They know mistakes are part of the process.
Yes.
And they strive to just do better and to learn.
Right.
There's a lot more flexibility. They can stop, they can shift tasks. Perfectionists they're fear and insecurity driven.
Okay.
They constantly raise the bar.
Yeah.
Right. Again, it's never good enough. It's never finished. And so it's different, right? Like, so I do think for a lot of us, we have that striving toward excellence, and then it becomes perfectionistic when we tie our worth, our belonging, our sense of safety to the standard.
Right.
And to completing a task at that level.
Interesting.
Is what I think about.
What do you think perfectionism protects us from?
I think definitely those emotional experiences that are really hard. Because if you, like me, when I was in high school, can make straight A's, and can do all of the activities, and I, have privilege in that kind of way, like I was born with some skills and some intelligence, and so I did really great in school, and so I didn't have to feel my insecurity.
Okay.
Right. When we are able to, when we can achieve, right, we can feel good about ourselves. Our worth is dependent on our level of achievement. So it kind of keeps us from having to feel terrible about ourselves and scared, anxious.
Fear.
Exactly. So I would say fear and insecurity. And then I think sometimes perfectionism too stems from, this was certainly the case for me. Like my home environment was incredibly chaotic and unpredictable.
Right.
And so I think if I could do everything right, then I felt safe. And that certainly is still the case for me today. I feel, I still feel that way with tasks. If I can just, it's this sort of like relief when I can finish a task, and it feels like if I can just, do it right and enough. I find myself getting into perfectionistic territory with like my, interior decorating, for instance.
Okay.
Something I love to do.
Right.
It's something I want to do really well, and I really enjoy it, but I can start to tip into like, it's never done. Got to keep doing more.
Yeah.
And it's like even my, AI helper will sometimes call me out on that because I use it. I use it
wow.
for sometimes my like interior decorating and design and stuff for ideas. And it's like, you're being perfectionistic. You should just be done. And I'm like, okay.
When AI starts to call it out.
I know it's a problem. It's like, I've noticed that you blah, blah, blah. You should just leave it for now. And I'm like,
wow.
Okay.
Okay. Okay, so your AI is clearly trying to support you in your journey towards mental health.
It is.
Which is great.
It's great. You're terrified. It's great for me.
A little nervous. I have some anxiety right now. This is new information for me. We kind of briefly talked about how perfectionism presents.
Yeah, like what does it look like?
Yeah.
What does it look like? Yeah, I mean, so there's the classic. I think most of us think about the
Exactly.
overachieving, right? The overachieving, the super, everything is spotless, everything is just right.
Mm-hmm.
We've got, the straight A's, uber work performance, wonderful reviews. That is like classic perfectionism.
Right.
But, and I explain this to parents all the time in therapy because they are like very confused by their child, for instance, who seems to deeply care about school, but who cannot muster the motivation to do the tasks. And so the flip side actually is like paralysis.
Mm-hmm.
Lots of people who are perfectionistic because they have those high standards that are tied to their worth and their safety and their belonging, they freeze.
And they do nothing.
They do nothing.
Yes.
They're super distracted. They're unmotivated. They're indecisive.
They're afraid of failure, so they do not attempt.
These kiddos, people would rather appear lazy than stupid.
Or than risk appearing to fail.
Right, which I think ties to them feeling stupid or inferior or, right, because perfectionism is tied to that insecurity. So it is another way to not have to feel the insecurity.
Mm-hmm.
But it's baffling to people because it's like, what? They're not perfectionistic. They're not really trying.
Right.
But it's the same underlying beliefs, the same underlying feelings that fuel that behavior pattern.
Right.
So it can look either way, actually, and be fueled by perfectionism.
And I think that's so fascinating. And I think you're right. I think parents and generally people don't have this conceptualization or this viewpoint of perfectionism. So I think this is going to be really helpful.
Yes. I also find it super helpful to think about perfectionism in particular diagnoses. Because these diagnoses can be fueled, like psychologically, right? Fueled by these core beliefs and these emotions. So OCD, for instance, certainly has a perfectionistic component.
Absolutely.
Right? There is moral OCD, relationship OCD, just right OCD, and people who are suffering in this way really, need it to be a particular way. Relationship needs to be okay all of the time. There's incredibly high standards around morals, and it becomes obsessive.
Right.
And really, there's still that core shame and fear.
Right.
I think around, belonging and competence and all that stuff, So, same thing with, I think, eating disorders, even depressive disorders, anxiety disorders. There's a bunch of shame. There's a bunch of fear, and a bunch of just ways that we try to manage those emotions to shield ourselves or protect ourselves from feeling the brunt or the intensity of them. So we develop all of these patterns of behavior.
To protect ourselves.
Yeah.
But the patterns of behavior are problematic.
Yeah, there's costs.
Oh, no. There's costs of maladaptive behavior, Dr. Parker. Oh, no. What are the costs for some perfectionistic folks?
Well, I mean, when I can remember, like in high school, just and that period of time you're talking about in grad school, where I think I was just like really, 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 perfectionistically achieving. I was exhausted. It's
exhausting to hear about everything you did in graduate school.
You should have known me in high school. I think if my family members are watching, they're going to be laughing that I thought I wasn't really a perfectionist anymore. They're going to be like, that's sweet. Well,
this is a Southern thing. Bless your heart.
Bless your little heart.
Right.
I was exhausted, and like for me, it really, I think, even though it's so ironic, but this is the cost of maladaptive coping, skills is I was trying not to feel anxious or
Right.
out of control,
Yes.
right? But being that busy is very anxiety provoking.
Exhausting.
It's very exhausting. So in the long term, I think perfectionism creates more anxiety, more burnout, more
Yes.
stress.
The thing that I was struck by in the research for this was the relational cost.
Oh, yeah.
That folks that are perfectionistic on some level, whether it's relational, moral,
There's
just
lots
right.
of different, domains in which
Right, just
perfectionism
right.
can pop up.
Exactly.
But relationships is one.
Well, in that thing, when you're perfectionist relationships, there's one of the costs might be that you feel you have difficulty with vulnerability, and you feel like inauthentic in relationships.
Yes, because when you have perfectionism around relationships, you think they should always be going right. They should always be okay. Conflict, mistakes, no bueno. People who are perfectionists don't do mistakes.
No bueno.
They don't do it. They don't want it. And
Right.
so it's no good. Right. So then if you are not okay with making mistakes,
Right.
you're not, a lot of us feel like being vulnerable is messy.
It's uncomfortable.
Messy and uncomfortable. We don't show that to someone else.
Right.
That would be considered a weakness or a mistake for many of us who are perfectionistic. So we don't put ourselves out there.
Right.
So then things are more superficial. And that obviously limits the amount of connectivity I think you can have in a relationship.
For myself, when I have had relationships where I feel like I am being authentic and vulnerable, which is I feel like I have the opposite problem. I can only be authentic and vulnerable.
Except to tell me that you were excited about the podcast.
Oh yeah, I was shy about that.
You were shy about that.
I was shy about that.
You were shy
I'm
about that.
bashful. But I think when I'm in a relationship with someone, a friend, and I feel like I'm being authentic and vulnerable, and I don't receive that, I don't want to continue in that manner with that person necessarily.
Yeah, it's not emotionally safe.
It doesn't feel safe
to be vulnerable with someone who's not also being vulnerable.
Yes.
Yeah, exactly.
Yes. And I've had that experience with friendships over the course of years where, and I have personally just a lot of challenge with friendships. I think I was raised in a really kind of closed environment, and so there was not a lot of options for friends.
Okay.
And so friendships were harder for me to find lasting, good, connective friendships. And
That makes sense.
when I did, I really poured my heart into some of those folks, and then that was also problematic.
That
You know
makes
what I mean?
sense. Yeah.
So then over the years, as I've gotten better at this experience relationally, I don't want to be with someone that it's not going to be close to me
Yeah.
in that inner circle.
In that way. And
Yeah.
that makes sense.
Yeah.
So we're talking about different areas of perfectionism. You can certainly be perfectionistic in an area or two, or you could be
Sure, across the
perfectionistic in
board.
all the areas. So
Yep.
relationships, we've got the moral. One that was, kind of popped up as we were thinking about this episode was health. This was interesting because I identified this on my own over the past couple of years on my mental health journey, because I was like obsessively reading
Doing all the wellness
and listening
things.
to podcasts and doing all the wellness things and trying to heal in the perfect way. And it was kind of crazy, but I was like super anxious and feeling really insecure and going through one of the hardest, periods of my life. So I was like, let me fall back on this, perfectionism thing, this obsessive, kind of dissociative, whatever. And then I realized, wait a second. What I'm telling myself here is that I need to heal to be okay.
Right.
And that's actually BS. So I backed
Interesting.
way off, because I'm like, you know what? Like, I actually think I'm maybe telling myself something that's not so great, that I'm not just okay as I am. And so I've been trying to be less
More
crazy
balanced.
and a bit more balanced with it and less perfectionistic, because I certainly was doing that in a pretty perfectionistic way.
I think you're right. I think until we had this research kind of in front of us, it wasn't as clear to me about this area of perfectionism. And to be honest, like transparently, I had like a very narrow view of this topic. And now I'm realizing much more about just the different domains of it and the different way it presents, and how, while it's not its own diagnosis or disorder, it relates to so many different areas.
I think it
things.
relates to, I mean, you can certainly be perfectionistic without having a diagnosis.
Mm-hmm.
I want to make that very clear. But I do think when we talk about perfectionism as being just a way to manage fear and shame
Yeah.
or avoid it, or, feel like we belong or we're
Sure.
safe, that it can get challenging.
Absolutely.
So, and we didn't talk about too. Maybe we should talk briefly about where it comes from. I think we've covered some, like
Right.
when you have when you are raised in an environment, or maybe just been in an environment where achievement is praised.
Yes, or really focused on,
or really really focused on,
Right.
focused on, or maybe it's a higher degree of what people are focused on or praising versus other things about yourself.
Sure.
Right? Like achievement, performance, then certainly we can develop perfectionism. I think when you feel like love or attention or affection is conditional, we kind of develop a fear of rejection.
Yes, if I don't this, then that kind of a thing.
Yeah, like if I am not acting in a particular way,
Sure.
or feeling in a particular way, or behaving in a particular way to my parents or to my partner or whatever,
Right.
then that means that I'm going to be rejected and not liked. So then we sort of develop patterns that are unhelpful. Or again, the need for control, I think, is another one. Like I think lots of us grow up being more perfectionistic if things were more chaotic, potentially, as sort of a need, for control. So that's another piece I think about.
I think there also might be tendencies within personalities towards perfectionism.
Yeah, temperament wise, that's important. So we are talking about the psychological underpinnings of perfectionism, but
And
there's also temperaments that you're born with that I think naturally predispose people toward more insecurity or caution. Like I think about really sensitive kiddos who, they do feel deeply, and they do tend, their emotions do tend to be bigger and overwhelming. And so there's definitely certain temperaments I think trace on, to perfectionism more.
I think my daughter has some tendencies towards elements of perfectionism. And so one thing, since I've noticed it and she's young, I really try to make sure that we reinforce effort and not outcome.
Yeah, so this is one of those things that can really help.
Right.
Yeah, definitely reinforce, like validate, praise effort, strategy, persistence instead of achievement. Separate your, help your kid, and for you, separate your worth from achievement.
Separate that, and also just really focusing on, like, it's okay to make mistakes.
Yeah,
it's okay to be messy. It's okay to learn. You don't have to know everything.
And practice just being good enough.
Yeah.
Send the email. Finish the task. Learn to live with that discomfort.
Yes.
Learn to live with that discomfort. And the more that you do, the easier it'll get. Ask yourself, what am I scared is going to happen if I do not achieve at this level?
Great question.
And what story am I telling myself about what it's going to mean about me?
Mm-hmm. What does this mean about me?
Exactly. So these are some of the things that help. When you start thinking, if you identify as being perfectionistic, start really identifying that fear and that shame.
Sure.
And challenging and practicing, good enough. Self-compassion, of course, right? With mistakes, like you were saying.
So hard. Also, I think we also always want to emphasize that these are general psychoeducational things, but if you feel like this is really a problem for you, we really encourage you to talk to a mental health professional, get some resources. If you feel like just your own work individually is not enough, because perfectionism is really tricky. And sometimes we're so used to our inner narrator, it can be hard to kind of call ourselves out in this process.
Yeah, for sure.
So, definitely want to normalize seeking support for things that are hard and difficult.
Yeah. If you have any questions about perfectionism, I know all the things.
Because that doesn't sound perfectionistic at all. Jeez.
I'm just saying I am one, so I get it. I know.
Okay, that's a little different.
That's what I meant.
This is not what you said.
That's what I meant.
What are you taking away from this episode?
That's what I meant.
All right. Well,
I'm taking away from this episode just the first thing that popped into my mind was just my trajectory and my progress, and it was really interesting and to think about my journey with perfectionism and how it sort of has morphed and how it's still kind of in there, and how I do think I've gotten a lot better with it, and I can identify all these things. And I just think it to encourage our audience and our listeners that it just takes some time and some intentionality, I think, at identifying the patterns and the thought processes and
all the things. I'm taking away just an expanded view and appreciation for this symptom adjacent experience. I would say it's
symptom,
and I think it's definitely helped expand my view, which I always appreciate. I love a bit of knowledge, and so this has been super helpful. The research of this has just been really, really helpful. So thanks.
You're welcome. I like to learn.
We know. This podcast is intended for informational and educational purposes only and is not a substitute for therapy, diagnosis, or any kind of professional mental health treatment. We hope that we can share with you our experience authentically and genuinely, and we hope that occasionally we'll make you laugh. Maybe you can relate to our quest and how we're psyched for sanity. The content we share is our personal opinions and insights. They are not clinical insights to anyone, and they don't represent or reflect any entity that we work and or have worked for in the past. But if listening to this podcast has made you think, we really encourage you to seek out a mental health professional in your area.